95, 97% of our patients are coming back saying, oh my gosh, my arthritic pain is gone. Hi, I'm Dr. Ron Letterman. I'm an orthopedic surgeon here in Southeast Michigan. I have had the privilege of taking care of this gentleman, Mr. Ven Johnson, who is a tremendous attorney and a tremendous athlete, scholarship tennis player in college. And I had the privilege of taking care of him for his knees and Achilles tendon tear.
Well, I guess really starts out probably playing way too much tennis and basketball as a kid because the wear and tear caught up to me about 10 years ago. And I was, at the time, doing a lot of course, I'm a trial lawyer, so I do a lot of trials. And I started to notice that my knees were painful. And as time marched on, because I continued to play tennis, I played tennis competitively since age 7, played in college, and then ever since for fun. And I was having 24/7 knee pain.
We actually ended up getting an MRI of your Achilles tendon, which showed a 50% tear.
Right.
Historically, and we even talked about this, before 2, 3, 4 years ago, I would have said to you, either live with it,
right,
wait for it to completely rupture, or we go in there and reconstruct it. And the reconstruction, or if you tore it and had to get it repaired, that's a 18-month recovery.
Right.
And you're not someone that takes being held down lightly. It was a significant prominence, a painful tender prominence, which was the layer upon layer of scar tissue. So we decided, after giving it a lot of thought, that you would be a good candidate for this regenerative stem cell treatment. So we briefly talked about some of the arthritis in your knee. You can inject it right in our office, no big deal. And we have not had a side effect from a stem cell injection. We have not had a reaction to it. We've had no rejection. So in your case, we're thinking, well, we've got 2 knees that are really hobbling you, and we have this Achilles tendon. So we ended up scoping one of your knees. We took the stem cell and put it into and around the Achilles tendon, and we put it in both your knees. We figure you're already asleep, why not?
And I think, half hour, 45 minutes after the procedure, I'm in the car and Mal's taking me home and we're all good, but it was amazing.
And in your case, at the cellular level, you have regenerated normal Achilles tissue. That's where I can breathe easier and know that when I give you the green light to go out there and do what you're going to do, I don't have to worry that you're gonna rupture your Achilles. You were the first one, but you're not the last one. We have other patients now with your response that we're doing for Achilles.
Good.
And we've been doing the knees and shoulders and other joints for a couple of years. And the repeat MRI only 3 months later, I still think it's a miracle.
To be honest, what you did and what you did for me in my life, you exceeded my expectations, and that's rare.
When I see video of you out there covering ground on a tennis court and seeing the force that's being put through this Achilles tendon to move a 6'4" frame,
right.
Which, by the way, how close are you to your college days? Because it's impressive.
Go there.
But that seems to be the typical response we're seeing in patients all across the board, whether they're 25 or 95, and we've treated everyone in between. I will tell you that if you're having any joint pain, any arthritic pain, if you've been told that there's no other options, I would strongly suggest considering giving us a call and come on in. Letterman Quarterwood Center for Orthopedics and Sports Medicine, we have a saying, and that is that we treat every patient that walks through the front door the way we would want our own family members treated. And frankly, I'd like my family members to stay out of the operating room, and that's the way I've done this for forever.